We hear about fiber all the time. It's great for digestion, heart health, and, of course, your gut microbiome. And most of us are only getting about half the recommended amount. But is a fiber supplement like Metamucil or Benefiber the answer? You might be surprised to find out what fiber supplements do and don't offer. Hello, and welcome to the Nutrition Diva podcast, a show where we sort fact from fiction and answer your questions about food and nutrition so that you can feel more confident about your choices. I'm your host, Monica Reinagel, and today's episode was inspired by an email from Cheryl Ann, who wrote, I have diverticulosis, and I was told to take Metamucil every day. I do this, but it makes me gassy, and I probably already have more fiber in my diet than most people. Do I really need this supplement? Now, we talk about fiber on this podcast a lot. It is a key player in digestive health, of course, as well as heart, bone, even brain health. And a lot of people do use fiber supplements like Metamucil or Benefiber on a daily basis, either to manage conditions such as diverticulosis or chronic constipation, or maybe because they're just not sure whether they're getting enough fiber from their diet. But as Cheryl Ann has experienced, they can sometimes cause harmless but uncomfortable symptoms like gas and bloating. And in some cases, a different fiber supplement may solve the problem, but in other cases, a supplement may not actually be necessary. So how much fiber do you actually need? You might have seen 25 or 30 grams as the recommended amount, but that is actually just a ballpark estimate because the official recommended daily allowance for fiber is scaled to how many calories you eat. So the guideline is 14 grams of fiber for every 1,000 calories you eat. Now, of course, everyone's calorie needs are a little different, depending on your size and your level of activity. But if you eat about 1,800 calories a day, which might be typical for a small to medium-sized body, that works out to 25 grams per day. If you're eating more like 2,500 calories, and that might be more typical for a medium to large-sized body, well, then it would be 35 grams of fiber. And this doesn't have to be super precise. A little more fiber one day, a little less the next is no problem. Unfortunately, however, most people aren't even close to those numbers. The average adult in the US is only getting about half the recommended amount of fiber. So you can see why fiber supplements might seem like a good idea. But before we go there, let's at least talk about what it would take to get the recommended amount of fiber from your diet. A day that hits the mark might look something like this. 5 servings of vegetables, that's 2.5 cups total, and that would be 10 to 15 grams of fiber. 2 to 3 servings of fruit might add up to 6 to 9 grams of fiber. 1 half-cup serving of legumes, like beans or lentils, or a serving of bran cereal, that's 7 to 8 grams of fiber. Maybe 2 servings of whole grains, which might be oats, whole wheat bread, or brown rice, there's 6 to 8 grams. And then maybe a serving of nuts or seeds, another 3 to 4 grams of fiber. Altogether, that adds up to 30 to 40 grams of fiber. And of course, every day might not look exactly like that, and that's okay. Some days you'll get more, some days less. It's really the overall pattern that matters. But this should at least demonstrate that getting enough fiber from food is doable. And just as an aside, those of you who use my Nutrition GPA app will probably notice that if you're scoring well in the app, you probably don't need to worry too much about getting enough fiber. But let's say that this is not yet your typical dietary pattern. Would a fiber supplement be a way to close that gap? Well, yes, but here's something that might surprise you. It may seem like taking a tablespoon of Metamucil or Benefiber each day would be a convenient way to compensate for a somewhat low-fiber diet. But a dose of those supplements only contains about 3 grams of fiber. It's just 10 to 15% of the recommended amount. It's just not all that much. While a fiber supplement isn't a very practical way to completely replace fiber-rich foods in the diet, there are some times when a fiber supplement may serve a more specific therapeutic role, but beyond just filling a gap. So, for example, some people need to limit fiber or avoid certain fiber-rich foods. They may be following a low FODMAP diet because they have IBS, or they may be on a low residue diet for other digestive issues or post-surgery recovery. And in these cases, a fiber supplement, as recommended by your healthcare provider, can be a way to get fiber in a controlled and predictable way. Fiber supplements may be recommended, again, by your healthcare provider, as part of a protocol to manage high cholesterol or high blood sugar. If your appetite is low or food intake is small for whatever reason, a fiber supplement can help maintain bowel regularity without requiring large portions of food. In addition, health professionals often recommend a fiber supplement to patients who are complaining of constipation or have been diagnosed with diverticulosis, because a higher fiber diet is known to be helpful in these situations. So the care provider may simply believe that you're more likely to use a supplement than to adopt a higher fiber diet. But if you are willing to prioritize fiber in your diet, it may be unnecessary. And in fact, it is possible to overdo it. Excessive amounts of fiber, whether from diet or supplements, can cause digestive discomfort and potentially even interfere with nutrient absorption. Ironically, too much fiber can even cause constipation, especially if you're not taking in enough fluids. Now, I know, having said that, some of you are going to write to me to ask how much fiber is too much. There is no official guideline, but intakes of 60 to 70 grams of fiber per day would appear to be safe as long as it's not causing any discomfort. And you definitely would want to work up to that gradually. And again, accompany that with plenty of fluids. But seeing as the average fiber intake for American adults is only 10 to 15 grams a day, I think most people don't need to worry about getting too much. If you decide that a fiber supplement does make sense for you, either to help with regularity, to support cholesterol or blood sugar levels, or to fill in some dietary gaps, you have some options. Fiber in general can be sorted into two big categories, soluble and insoluble. As the name suggests, insoluble fiber does not dissolve in water. Instead, it adds bulk to your stool and it helps food move through your system more quickly. This is what our grandmothers used to refer to as roughage. And foods like wheat bran are good sources of insoluble fiber. Most fiber supplements, on the other hand, are primarily soluble fiber, meaning that they do dissolve in water. They can also help with constipation by making stool softer. But soluble fiber's other big trick is providing a food source for our gut bacteria. This is great for the microbiome and gut health, but the fermentation of soluble fiber by those gut bacteria, that's what's responsible for the gas and the bloating that some people experience. But even among the soluble fiber supplements, there are some differences. Metamucil is made from psyllium husk, and it's a little bit unique in that psyllium husk actually contains both soluble and insoluble fiber. It's about 70% soluble. So it can be kind of a one-stop shop. And its gel-forming action also is particularly helpful with blood sugar and cholesterol. Benefiber, which is made from wheat dextrin, is probably the next best known fiber supplement. It is primarily soluble fiber, so you wouldn't get any of that stool bulking roughage benefit. And it's also not quite as effective in regulating cholesterol or blood sugar. On the other hand, the soluble fiber in wheat dextrin is more slowly fermented in the gut, and for some people, that translates into less gas. An even better option for those who struggle with gas may be a fiber supplement made from PHGG, that stands for partially hydrolyzed guar gum, and Sunfiber is one popular brand that you might see. PHGG is actually considered to be low FODMAP, so this one may even be a good option for people with IBS. A slightly worse option, from the gas perspective anyway, would be a supplement made from inulin or chicory fiber. Although there is some research suggesting that inulin can be helpful in controlling appetite and weight, it is a very fast fermenting fiber, which can translate into some pretty epic gas. One advantage to relying on diet to provide most or even all of your fiber is that you don't need to worry so much about these fussy little details. By consuming a variety of plant foods, you will automatically be getting a blend of insoluble and soluble fiber with a mix of slower and faster fermenting fibers. But if you decide that you do want to incorporate a supplement, hopefully you now have a better understanding of what to look for. Just remember that fiber supplements will generally provide a relatively small amount of your total fiber intake. Thanks so much to Cheryl Ann for submitting this question. And if you have a question you'd like me to answer, you can email it to me at nutrition@quickanddirtytips.com. And you can also leave me a voicemail at 443-961-6206. If you'd like to find out about having me speak at your next live or virtual event, you can learn more at wellnessworkshere.com. Nutrition Diva is a Quick and Dirty Tips podcast. Our team includes Brandon Getchis, Nathan Sems, Davina Tomlin, Holly Hutchings, Morgan Christensen, and Nate Hoops. That's all for this episode. Thanks so much for listening. I'll see you next week.